Welcome everyone, and today we are extremely fortunate to have Dr. Archana Reddy with us, and on this platform where Sanrai is actually trying to create awareness in the breastfeeding week. Uh, Really an honor, ma'am, to have you in this particular video clipping, because we know that there are certain mothers who are not aware of the fact that something called lactation consultant, a person who is there available in the hospitals, a wing is available. So this is a very good opportunity that we spread this awareness. So let's start and begin with the very first question. Like, can you please describe a typical day in your role as a lactation consultant, ma'am?
Thank you, Pallami. Thank you so much for that lovely introduction. So, I am Archana Reddy. I am a lactation consultant. I'm an IBCLC. So, I am working with both mother and child. So, here my typical day starts like I first start with my IP rounds, inpatient rounds. That means where the mothers and babies are delivered or who are waiting for delivery, so I just go and meet them, and I also help them physically and see the latching and assessment, how they are. I will assess their latch and position, and if there is any requirement for any corrections, I will help them in that. I do counseling the parents. Matlab, it's not only the mother. I do counsel the both parents, mother, father, partner, whoever
Yes.
is available, and the family members who are available regarding the
Mm-hmm.
importance
Mm-hmm.
of breastfeeding, regarding the how to manage at home, all these things I will start. And then I will also visit the NICU where there are premature babies and sick babies are present,
Yes,
and
yes.
I do counsel the mothers where there is requirement with the help with pumping and all, or if they are facing any challenges with the breastfeeding the babies, or if the babies are not taking proper cup feeding and all. So all these things I do monitor. Then the OP rounds.
Oh,
Then there will be my OPD consultations. Mothers who require help will come in the OP, and we do consultations in the OP schedule. And again, there are other things like trainings, different types of
yes,
trainings, antenatal
yes.
classes, staff training. These all are part and parcel of my job in a typical day. But again, as I told you, it's not same on every day. There are some very difficult days. There are some very light days.
Yeah.
So
So
this
it's
is the
completely like back to back schedule, which you are
yes.
completely packed schedule you have. And that is the reason, like, we are very honored to have you today, because you have squeezed out some time from your such a busy schedule and you are giving us time. So if I just can understand, like, how do you handle situations when mother is struggling with breastfeeding, but it is actually they have to continue? So how do you help the mothers in that case?
So, for example, if any mother is struggling to breastfeed, but she is determined to breastfeed, she wants to continue. She's facing lot of problems, but she wants to continue. So first thing is that I provide her support
Right.
and practical advice, and I encourage her. Why
Okay.
I am talking about practical advice is I can't say her, yes, you can do it, you will be able to do it.
Mm-hmm.
If there are
Mm-hmm.
practical problems where that is not possible sometimes,
Mm-hmm.
maybe for few days that might not be possible, or that baby might need some more time, so it is very important to give practical advice. I assess the challenge what the mother is facing and
Mm-hmm.
give personalized solutions to that. It
Right.
is only to that baby and mother that solution would work.
Right.
So,
Right.
and I also remind her that progress can take time. It is not like magic, like with one
Magic.
consultation, things
Right.
will happen. But
Mm-hmm.
definitely, I will put my efforts, and I will also request the mother to put her 100% effort to make it successful.
Absolutely. This is wonderful, ma'am, because which we have also seen that it varies from mother to mother. So each human being, the physiology is so complicated and so different from one to the other. So this advice is very, very important, ma'am. So in that case, like what support do you offer to mothers who have latching issues?
First thing, I assess the baby during the breastfeeding. First thing I will do is that
Okay.
how the baby is doing breastfeeding in front
Mm-hmm.
of me at least for 5 minutes.
Okay.
First
Hmm.
5 minutes.
Hmm. Hmm.
Then I provide hands-on guidance. If there is any mistake happening with the latching of the breast or with the
Mm-hmm.
positioning of the baby,
Right.
and look at the comfort level of both mother and baby, change
Mm-hmm.
the positions, teach them different types of position, teach them how to do deep latching, and also I would encourage the mother to practice in front of me. If
Mm-hmm.
it is an
Very
OP,
important.
if it
Hmm.
is an OP consultation, I
Hmm.
will do, if my with my hands-on guidance, she will be able to do properly. But again, after going home, she will be confused. So
Hmm.
I would suggest her to sit there for one more session, one more maybe for 1.5 an hour or 40 minutes. Then again breastfeed the baby in front of me before going home on
Very good. Hmm.
herself completely without any
Absolutely.
support or help. So that
Right.
will also give her confidence that she can do it after going home also.
Yes, yes, yes. So that is very, very important because you are actually almost spoon feeding the entire process so that if there is any confusion, it can be resolved in your chamber itself.
Exactly.
Right. Well, how do you educate mothers who want to go back to work? Like me, I am working all the time. So, in that way, how do you educate those mothers, like who wants to go back to work?
So, to support the mothers who are returning to work and they would like to continue breastfeeding, first thing I would suggest them to get a personalized schedule, pumping schedule, storing schedule, and
Okay.
breastfeeding schedule. They should have their plan, how many hours they are going to be away from the baby, how much time they will get in the office to pump, or when they should take breaks for pumping, or
Right.
if any crutch is available in the office and the baby is at the crutch, how she should take her breastfeeding breaks.
Hmm.
All these things I would suggest. Again, as I told you, it's a personalized schedule, and she should at least come to a professional 15 to 20 days before she starts her office so that she will practice everything at home before going, because there is
Absolutely.
anxiety
Hmm.
between both mother and baby.
Hmm.
Separation anxiety happens to both mother and baby,
Hmm.
so always good preparation before starting will always help. So she can have her pumping schedule on the table, she will have her storage bags, everything ready, the storing schedule is ready, how to warm, all these things if it is
Hmm.
ready, then it will be like a cakewalk to her.
Absolutely. It's like a practice which you try to do with the
Exactly.
mothers.
And also she
Hmm.
should maintain her supply while she's away from the baby. So that
Yes.
also plays a very, very important role. So talking to office people, getting the place where she can pump and all these things also she should be ready before joining.
Absolutely, absolutely wonderful. So, well, there are mothers who decide suddenly to stop breastfeeding. So, what kind of support are you giving to them?
See, if a mother is deciding that she cannot continue to breastfeed for any reasons, for her mental sanity or anything, first thing is that I like to provide her a non-judgmental space where she can
Hmm.
speak to me freely and
Yes,
discuss about this decision. I am not going to take the decision. The mother is going to take the decision. I am there to help her to sail through this smoothly.
right, right.
So I offer how to wean gradually. Some of
So
the
it's
mothers after 1 year and so we are tired, we are
mm,
not able to sleep and all, we would
mm,
like to wean off kind of. So the weaning should always happen gradually. Or
absolutely.
sometimes I will also give them, for example, if the baby is older baby, like more
Mm-hmm.
than 6 months old baby, but mother is a homemaker, but still she want to wean off for other reasons, house responsibilities, not
Sorry.
able to sleep properly, no support system present at home.
Yes, yes.
And sometimes, there are elder babies who she has to take care. So
Mm-hmm.
I would also advise them, better if you can start pumping and giving your milk through cup or tumbler or something like that to the baby than completely weaning off. This is one suggestion I give. But still, if
Okay.
the mother is still no, I am still not able to convince myself and do breastfeeding or pumping, I will not be able to give time or anything. I will support her in transitioning to any supplementation if required, according to the age of the baby. And
Mm-hmm.
also, I will also help her to create a feeding plan accordingly so that she will not have any discomfort while weaning,
Mm-hmm.
and baby will not have any discomfort. So my major focus will be respecting the choice, the mother's choice, and she should feel confidence, and I will support throughout this transition.
Absolutely. So, a kind of mental counseling, you are actually doing it. Uh, trying to wear her shoes, her kind of situation where what condition she's going through. So, you understand completely. This is really fantastic because mothers are going through so many hormonal changes, and maybe sometimes they are battling themselves. And
And lack of support system also.
yes, even a social pressure is there on them, so many things to be considered at a time. Wonderful, ma'am. So again, if there are certain cases where how do you handle a case where you need to support a premature baby and their family? Like, there are cases, I'm sure there are.
Uh, I feel, I always say to so many people this thing, but I would like to repeat it. The bravest women I have seen are the mothers whose babies are in NICU. Whether it is for
Mhm.
24 hours, 24 days, or it's more than 3 months, I have seen babies who are in NICU for more than 6.
Hmm.
And I feel that they are the bravest women I have ever seen.
True,
So,
absolutely.
so to support them, first thing is that I would tell the mother to accept the truth
Hmm.
that their baby is going to stay in NICU, stay away from the mother for whatever the days possible,
Yes, yes.
right? First is accepting, and I also provide them specialized guidance, uh,
Okay.
uh, right, with emotional support and breastfeeding support, because
Okay.
these two go hand in hand.
Absolutely,
They
absolutely.
require they require emotional support, and also they require breastfeeding support also. And I help them to maintain and establish their milk supply, like
Hmm.
frequent pumping. And
Hmm.
sometimes some of the premature, if they are extreme premature, they will not be able to do direct breastfeeding immediately. So
Right,
they should how they should do plan their pumping schedule and all, how to store the breast milk for their own babies in later on stages if required. All
right.
these things are educated. And also, I would also help them in choosing a right pump which is required for them. What kind of
Mm-hmm.
pump they should take, depending upon the requirement on all these things. So here, my
Okay.
goal will be, first is educating the mother, educating the family, support their breastfeeding journey, whether it is the direct breastfeeding or providing express breast milk.
Okay. So in that case, good that you have come to a point where you are actually sometimes when it is necessary, you are advising for pumping. So what are your views about pumping and the kind of pumps that are available in the market? What do you think about those pumps?
So, see, the pumping is a definitely breast pump is definitely a helpful tool for maintaining. Sometimes it is for maintaining the supply. Sometimes it is when the baby is away from the mother due to whether the mother is sick or baby is sick, any reason. And also for the working mother, they can go to their work peacefully because they know that
Yes,
their babies are getting good nutrition, what they were
absolutely.
getting when the baby was with them. So,
Mm-hmm.
and also sometimes managing some breastfeeding challenges also, pumping
Hmm.
is essential. But again, I would say it is like both pros and cons are there. Excessive pumping is also not good. Unnecessary pumping is also not advised. I would not advise if the baby is term baby without any complications, baby is with the mother and the baby is breastfeeding, latching and position, everything is absolutely fine. I would not recommend any kind of pump to that mother.
Okay, okay, okay.
There is no requirement, I would say.
I
Right?
completely understand that. Like
So,
you are suggesting pumps to mothers where you find there is a requirement. Else,
exactly.
you are actually trying to make the mothers feel that they should be feeding
Yes.
directly.
Direct breastfeeding. That's what. When they're facing challenges,
Hmm.
definitely I would advise. So there are different types of pumps like manual pumps, electric pumps, hospital grade pumps, and some wearable pumps are also nowadays there we are seeing them. They're wearable pumps also.
Hmm.
So the best ones would be hospital grade pumps because they are more powerful. If a mother is exclusively pumping mother, sometimes she takes a decision to take an exclusively pumping route. Sometimes the babies are in NICU and twin babies are there. They are in NICU and mother needs to maintain the supply. So definitely hospital grade pumps would help them do this when they are doing very often and long term pumping. And
Right.
like manual hand pumps, like they are manually operated and they are used for occasional use. Long term uses you cannot do manual pumping. And coming
Exactly.
to personal pumps, electric personal pumps also, again, there are few challenges that they face, like the flangings, flange settings
Yes.
and all cannot be proper because every pump company is not making the proper flange which is required for each and every mother. So those challenges also mothers face because and some of the electric personal use pumps are doesn't have a good suction power and all. So the maintenance of milk production is not good. And also the major issue is wear and tear. If they are
Yeah.
using for long term basis, there is lot of wear and tear happen to these pumps and they are costly also. So
Hmm.
that is also one more thing. And nowadays we see some wearable pumps, that the pumps that can be discreet, small. But these pumps are again for occasional use, I would say, not for a regular use. And to maintain the supply and for long term or exclusive pumping moms, it is difficult with these wearable pumps.
Right, absolutely. So, ma'am, what is the best approach? Do you think that buying a pump or renting a pump will be better for a mother? Like, there
Uh,
are options,
Yes,
since there are options.
actually, it just depends on the individual need, I would say.
Mm-hmm.
Both are having their own pros and cons, as I say. If a mother is affordable and she can get a like good long term use and good pump if she is able to buy. For example, a working mother, her insurance is covering something, a good pump if she is able to get, definitely she can buy a pump. And renting is again a very good idea, I would say, if a mother is using it for a short-term basis. For example, if a baby is preterm baby is in an ICU, she will get a good hospital grade pump on a rent, and after some few months, once the baby is able to do breastfeeding, she can directly start breastfeeding their babies.
Yes,
So
yes.
they both the options are good, and they have both of them have equally advantages and disadvantages also, I would say. So it is up, we are, see, as I told you, I will be only giving them the advice,
Yes. Choice
and
is
I will
theirs.
give them the choices. The decision is again with
Is
the
theirs.
parents.
Yeah, yeah, yeah. Absolutely, ma'am. So, do you think that, how is it environmentally friendly to rent a pump? Like,
Because environmentally friendly, this is a very good point because again, most of the pumps are made up of plastic and silicone, and pumps are like, for example, if it is a hospital grade pump and if you are getting a rent, the machine will be manufactured only once and it can be used multiple times. Like it can
right.
be used for so many times. So that is very good. That is very nice point you have taken up, and only the flanges and the containers which you need to buy and use it. So there is no new pumps are manufactured there and
Required.
all.
Absolutely.
Requirement is there. So definitely that is the environmental friendly option. Definitely, I would say. and the most environmental friendly option is directly breastfeeding, I would say.
Sure, definitely, yes. And what do you think? Like, are rental pumps readily available, and how easy is the process of obtaining one? If you can just give some ideas about it, about the rental.
Yeah, in India also now we are getting rental pumps actually. We are having some sources, some local, like if you contact some local NICUs and SNCUs, there are providers who are providing pumps also, hospital grade pumps on rent. And you can talk to a lactation consultant in your own city. They will be able to give you advice. There are some websites which are providing, and social media also. If you search, you can get to know some of the companies are definitely providing renting solutions for pumping. As I said, first thing is that plan settings should be there. If you're going for a renting pump, you should get make sure that you should get a correct plan setting to be done, so that efficient milk removal will happen. And if you're renting, it is always better to go for a hospital grade pump renting, because that gives more efficient results. And also
Yes.
those pumps are very high in suction levels, and milk output would be good. Maintenance of milk production will be very good with hospital grade pumps. So again, availability is very good with these pumps. And you can definitely go with it's available in India, I would say, nowadays,
Yes, yes, of
and
course.
it is booming now.
Yes, so that's a very important factor that a mother can easily access any of the pumps. They either can buy, they can get it on rent, and if they do not have any issue, they can directly feed the child. So, our main purpose, ma'am, is just to make sure that the baby is getting the right nutrients, right? Because otherwise, they will quickly shift to a formula, and that is actually harmful.
Exactly. That's how I would say is that first priority should be given to direct breastfeeding always. Once the direct breastfeeding is not possible, or mother is having any issues, or mother is going back to work, definitely you need not switch directly to formula or infant milk substitutes or any other supplementation. Definitely you can give baby your own milk by expressing and giving. And but again, there is cost. Unnecessary pumping definitely causes lot of problems, and then it's lot of work, I would say. Pumping,
Yes,
unnecessary
yes.
pumping creates a lot of work to
Yes,
mothers
yes,
also,
yes, of
because
course.
cleaning, sterilization, all these things are also present. So that is the reason you should always think before advising anybody for pumping.
Yes, but there are certain cases like flat nipples are there, like maybe inverted nipples, or maybe any latching issues. So in that case, they can always go for
They can
pumps.
always go for few days. Once the things are settling down, they can go to breastfeeding.
Absolutely,
100%. But
absolutely.
mainly, your pumping would be mainly, useful, and 100% requirement is during the premature age of the baby, and
Yes,
working mothers, and the babies who had not latched for any other reasons.
yes, yes. So NICUs and these are the areas where you are
Working
actually
mothers, yes, there
working
we have to
mothers.
concentrate more.
Yes. So, ma'am, it was actually a wonderful session, and so much of like we got so much of insights through this short session. We will be having such sessions definitely, primarily because of the Breastfeeding Awareness Week. We are doing this, and really an honor to have you, and you have taken out time from your such a busy schedule. Wonderful to have you, and we will be having you soon again. I'm just trying to squeeze out again sometime from your busy schedule later, and we'll definitely have one more feature. So thank you so much, and wish you all the best, and I hope all the babies whom are and the mothers who are under your advice are doing wonderfully well, and looking forward to more such good interactions in future, ma'am. Thank you so much.
Thank you, Polumi. Thank you so much. It was nice having a conversation with you, because I feel that, see, this year's theme of World Breastfeeding is closing the gap. Breastfeeding
Yes.
support to everybody. So I am trying from my end to educate and empower from each corner wherever I can, like coming to nurses, healthcare professionals, mothers, students, everywhere, wherever
So no stones
society.
unturned.
No.
Absolutely no stones unturned. Absolutely, ma'am, you are actually doing a wonderful job because mothers need these kind of support regularly, and the awareness which you are creating in whichever way possible, this is really going to help definitely in future. And that's the reason we will keep tagging you for anything that we require, and we will definitely seek your advice on that.
Okay, Palami. Thank you so much. See you
Thank
soon.
you, ma'am.
Bye.
Okay, have a nice day. Bye, bye.